Assalamualaikum and hello to Professor Zainal. My name is Hafizah, and for this special study module assignment, I will be presenting about cardiovascular system, and the specialty that I'm interested in is pediatric cardiologist. So, to begin with, what is a pediatric cardiologist? A pediatric cardiologist is a medical doctor who specializes in diagnosing and treating heart conditions in children from infancy up to adolescence. This slide shows the anatomy of the human heart. The heart is a muscular organ located in the mediastinum between the lungs, slightly to the left of the midline. So the heart is divided into four chambers: the right and left atria at the top and the right and left ventricles at the bottom. So the right side of the heart handles deoxygenated blood and the left side handles oxygenated blood. Other than that, the heart valves consist of tricuspid, mitral, pulmonary, and aortic, which is to ensure one-way blood flow and prevent backflow. Also, the heart is enclosed by a protective sac called the pericardium. The pericardium consists of two main layers, which is the first one is fibrous pericardium, the tough outer layer that anchors the heart in place and prevents overdistension. And the next is serous pericardium, which has another two layers, which the first layer is parietal layer that lines the inner surface of the fibrous pericardium. And the next layer is visceral layer, also known as the epicardium, which lies directly on the surface of the heart. Also, between the parietal and visceral layers is the pericardial cavity, which contains a small amount of pericardial fluid. And this fluid reduces friction during heart movements. Next, the heart also has the myocardium, which is the thick muscular middle layer responsible for contraction. And last but not least, the endocardium is the smooth inner lining that allows blood to flow easily through the chambers. The next slide is about physiology of the heart. So basically, the basic functions of heart is to supply oxygenated blood to the body, send the oxygenated blood to the lungs, maintain blood pressure and cardiac output, takes away other waste, and last but not least, control the rhythm and speed of your heart rate. Also, I attach histology of the heart in this slide. So the heart consists of intercalated discs, which is to attach each cardiomyocyte to its neighboring cell. Next is gap junctions to permit rapid transmission of action potentials from one cell to the other. And last but not least, fascia adherens, anchoring proteins that hold the myofibrils and the cardiomyocyte cytoskeleton in place. So I'll be talking about the cardiac cycle of the heart. So the heart works in a continuous cycle called the cardiac cycle, which consists of three main phases. First is atrial systole, where the atria contract to push blood into the ventricles, and this corresponds to the P wave on the ECG. Next is ventricular systole, where the ventricles contract to pump blood to the lungs and the rest of the body, and this is represented by the QRS complex on the ECG. And finally, ventricular diastole occurs when the ventricles relax and fill with blood again, and this phase corresponds to the T wave on the ECG. And this coordinated cycle allows the heart to pump blood efficiently with every heartbeat. Next, I'll be talking about biochemistry of the heart, specifically in cardiac action potential. So the definition of cardiac action potential is a small voltage change that initiates the contraction of cardiac myocytes. Cardiac muscle contraction is driven by electrical signals called action potential, which happen in 5 phases. The first phase is phase 0, rapid depolarization. In this phase, sodium rushes into the cell, making it positive, which starts the contraction. Next phase is phase 1, partial repolarization. Sodium channels close briefly, causing a small drop in voltage, getting the cell ready for the next phase. Next is phase 2, which is plateau phase. In this phase, calcium ions slowly enter the cardiac cell through calcium channels, while at the same time potassium ions leave the cell. And these opposite movements balance each other, so the membrane potential stays relatively stable instead of dropping. And the plateau phase prolongs the contraction, which is important for giving the heart enough time to pump blood efficiently. So in this phase, there's no contraction happened. And the next phase is phase 3, repolarization. In this phase, calcium channels close, potassium keeps leaving, and the cell becomes negative again, leading to relaxation. And last but not least, phase 4, which is resting phase, the cell is ready for the next beat maintained by the sodium-potassium pump. Next is about pathology of the heart, and I did my research about Kawasaki disease. So Kawasaki disease, also known as Kawasaki syndrome or mucocutaneous lymph node syndrome. So about this disease, it causes swelling called inflammation in the walls of small to medium-sized blood vessels that carry blood throughout the body. And the biggest concern in this Kawasaki disease is their coronary arteries. These coronary arteries supply blood to human heart, to their heart. So children with affected coronary arteries can have heart tissues as a result. So usually Kawasaki disease most often affects the heart arteries in children younger than 5 years old, and usually it affects boys more often than girls. These are several informations about Kawasaki disease. First, I'll be talking about the symptoms. So, for Kawasaki disease patients, they'll be having symptoms like fever lasting for at least 5 days, red or pink eyes without discharge, rash mostly on your child's trunk but sometimes elsewhere too, and swollen lymph nodes in your child's neck. So, about risk factors, there are several risk factors of Kawasaki disease. The first one is male sex, second one being younger than age 5, and the third one is being of Pacific Islander or Asian descent. And the cause of Kawasaki disease is unknown. However, there are possible Kawasaki disease there are possible Kawasaki disease causes like infections or environmental factors or even genetics. And for Kawasaki disease patients, they'll be having complications, for example, aneurysms, inflammations in the heart, hepatitis in the liver, pancreatitis in the pancreas, and also poor heart function or heart failure or heart attack. So to diagnose Kawasaki disease, the patient need to undergo blood tests, urinalysis, echocardiogram, electrocardiogram, or CT using X-rays and a computer. And to treat Kawasaki disease patients, one of them is to give human globulin or human blood proteins that the patients receive by IV. Next, by giving them aspirin. Next, IV fluids for hydration. And last but not least, medications for pain and swelling. So I'll move on to the technology related to the heart. So I'll be presenting about 2 technologies. The first is cardiovascular magnetic resonance, CMR, also known as cardiac MRI. And this is a medical imaging technology used for the non-invasive assessment of the heart and blood vessels. It is a gold standard for assessing cardiac volumes, function, and mass, and can help diagnose various conditions without radiation exposure. Next technology, the second technology is artificial heart pacemaker. Pacemakers correct slow or bradycardia or irregular heartbeats, ensuring the heart pumps blood efficiently to the rest of the body. And they work by sending electrical impulses to the heart to maintain a normal and steady rhythm, especially when the heart's natural system malfunction. Before I want to conclude my presentation, I want to talk about a well-known specialist featuring Dr. Anne Hackley. So basically, Dr. Anne Hackley is a consultant pediatric cardiologist with over 20 years of experience, and he practices at Sunway Medical Center in Subang Jaya and Petaling Jaya. So, Dr. Anne Hackley is an alumni of UKM and UM, and also his a professional expertise in transthoracic and transesophageal echocardiography, diagnostic cardiac catheterization, percutaneous cardiac interventions, and infant and child vaccination care. Dr. Anne Hackley also received several awards for his service that makes him a prominent and inspiring doctor to me. Lastly, for the conclusion, pediatric cardiologist is essential in ensuring healthy heart development from infancy through adolescence. Early recognition and appropriate management of congenital and acquired heart diseases can improve survival rates and quality of life in children. With advances in diagnosis tools, medical treatment outcomes for pediatric patients continue to improve. A multidisciplinary healthcare approach, together with family involvement, plays a crucial role in providing comprehensive and effective cardiac care for children. That's all from me. Thank you very much.